Kalina, infectious disease physician at Joseph Brant Hospital. Dr. Kalina, good to see you.
You too, Jen.
So 2 million cases since this all began, and meantime we're seeing them go higher, and we don't really know if the numbers we're getting are accurate. They may be underreported. What's your thoughts on where the numbers might actually be?
Yeah, it's, as you said earlier, an unenviable milestone to reach. And I completely agree. I think the numbers are far higher than what we're actually seeing right now. Because I think everybody, myself included, knows several people personally who have tested positive just based on a rapid test, for instance, and have yet to be able to get a PCR test, which is what gets recorded. So the numbers are definitely higher than they are. And I think it reflects really the fact that there's a lot of COVID that's circulating in all of our communities across the country right now.
Is there any doubt in your mind we're going to see an uptick a week or 2 weeks from now after Christmas?
No, I expect the numbers will be far higher, certainly in terms of the raw case counts and that sort of thing. But what I'm hoping for is that the bump that we see in hospitalizations and of ICU cases doesn't go up as much. And that's yet to be seen. I know there's been a slight increase over the course of the past few days in ICU numbers, but my fingers are crossed, as are all healthcare workers.
Sure. And as we hear of those reports, Dr. Kalina, of people testing positive with a rapid test but not being able to get a PCR, people are being told to isolate for 10 days. We're also hearing chatter of that time being reduced from 10 days to a bit lower. Are you on board with that, or do you think 10 days is the safest amount that we can wait?
So from what we can see so far, 10 days is the safest length of time to wait. And where a lot of this chatter is coming from is because of staffing shortages across particularly the United States. And we are seeing that here in Canada as well. But I know the CDC did change some of their guidelines recently. But it does largely reflect the difficulty that healthcare institutions are having with continuing staffing. We're seeing this as well, of course, with airlines canceling flights over the course of the past several days because of people that are isolating. But I do think that it's important that these numbers and the length of time that people have to isolate is reflective of what we can see in terms of transmissibility and not staffing issues, as difficult as that is to reconcile with.
Yeah. When we hear about Omicron and people describe it as a milder infection, we have to keep that in context, right? I mean, mild compared to what? Compared to Delta, compared to the first Alpha COVID? How would you categorize Omicron? And is it different for every individual in many ways?
It's certainly different for every individual, and I've seen individuals with Omicron confirmed in intensive care even. So it really does have a full range of disease that it can cause. And while I do recognize that it does seem like a lot of the symptoms are, yes, milder than what we were seeing, particularly with Delta, do keep in mind that a mild disease, quote unquote, is just that. You don't need to go into the hospital. You don't need oxygen supplementation. So the definition of mild is more of a medical definition than rather kind of a personal definition. So don't discount it yet. And also keep in mind that even if we have fewer people that need hospitalization, with the numbers that we're seeing right now, that can still amount to quite a problem for the healthcare system.
Indeed. Okay. Dr. Dale Kalina, an infectious disease physician at Joseph Brant Hospital. Always good to talk to you, Dr. Kalina. Thank you.
Likewise. Take care.